I think this bill is an opportunity to revisit the conversation about the federal government's role, and where our spending goes is not just a reflection of what's important to us as a nation, but it should also be a reflection of what exactly the primary roles of the federal government are. So starting with national defense, immigration control, homeland security, these are things that get bolstered by this bill. On the tax side, I agree. However, I think it's important to keep in mind that without extending the 2017 tax cuts from the Tax Cuts and Jobs Act, most Americans would see a tax increase this year. So some of the jargon that we use in Washington around tax bills and spending bills is the same as the way that Americans would use these terms colloquially. This isn't necessarily a big tax cut, and it's an extension of tax cuts from 2017 to ward off tax increases that most Americans would see. Now, there are a couple of tax provisions, like the huge increase in the state and local tax cap, that do, I think, create political and policy problems for the GOP. I'll be curious to see what the Senate does, if the Senate makes some changes to some of these provisions. But of course, we're going to have until July 4th to see changes from the Senate back to the House and ultimately to President Trump's desk. The bill primarily affects Medicaid through adding work requirements. And it's not strictly a work requirement, but it means if you're caregiving, if you're volunteering, if you're looking for work, then you can meet the work requirement in Medicaid. This is a pro-work incentive in the Medicaid program. If I had my druthers, we would have gone further with Medicaid reform in this bill. You can't get everything you want, but there is a provision in 2014 when the Obamacare or Affordable Care Act expansion of Medicaid started. It started funding states at about 90% to add new able-bodied, working age, childless adults to the program. This was a huge mistake because it created a dual system within Medicaid where traditional Medicaid enrollees like pregnant women, like children, like people with disabilities get a lower match rate from the federal government. So as I said at the outset, I believe that the changes in spending as well as taxes in this big, beautiful bill are an effort to get back to the federal government's primary role. This will ask states to step in and make changes to their Medicaid programs as they see fit. Of course, we remember the policing powers that have to do with health and safety of citizens, healthcare. Those things should be primarily handled at the state level. So for people who are on Medicaid who might be worried about the work requirement in this, yes, there's options here. They could go out and fulfill the work requirements. They could petition for changes at the state level in terms of what's available to them. They could also look to private healthcare coverage, and there are things that states can do to subsidize private healthcare coverage. And if you ask anyone on Medicaid if they'd rather have Medicaid or private health insurance, they'd choose the latter. So I hope that our government will work to expand access to the private health insurance that should be the first option for many people who are working age, able-bodied, childless adults.